In 2012, medical practitioners recorded 1.6 million pregnancies around the country. About 5.5% of those expectant mothers were found to be living with HIV. This translated to 88,000 pregnant women whose babies were at risk of acquiring HIV. With an average transmission rate of 30%, it was estimated that about 26,400 babies would get infected with HIV in 2012 alone through mother-to-child transmission. We covered the 193-kilometer stretch from Kampala to Gomba district in 2.5 hours to our destination at Madu Health Center 4 in the scorching sun. We were welcomed by Miro Shafik, the hub coordinator at the center. Shafik is supposed to work 5 days a week, but he sometimes stretches it to 7 days to ensure that mothers living with HIV receive adequate attention at the center.
We collect samples from the babies from exposed mothers. Once we collect those samples, they are sent here. The rider goes and picks them from those facilities, and then he brings them here. When he brings them here, we sort them out, pack them, and then we send them to the CPHL for DNA PCR testing.
The government improved the lab and authorized an HIV care treatment provider called Mildmay Uganda to take over as an implementing partner. Mildmay was charged with the responsibility of ensuring the success of a global plan reducing new HIV infections known as the elimination of mother-to-child transmission, or EMTCT. The Director of Medical Services at Mildmay, Dr. Yvonne Karamaji, explained the project's objective.
We want to make sure that all women and girls of childbearing age do not acquire HIV. We want to make sure they don't get new infections of HIV. That is where you start from. Then we go to prong 2, where we make sure that women who are HIV positive avoid unwanted pregnancies.
Madu Health Center 4 is currently the only health facility where elimination of mother-to-child transmission of HIV services are offered in Gomba district. Its laboratory services are utilized by 18 other health centers in the district.
Since for us here we have some of the complicated machines, which for them they don't have at their own facilities. So when we receive those samples, we process them, then others will refer them.
The government shifted its focus from the prevention of mother-to-child transmission of HIV campaign, PMTCT, to the elimination of mother-to-child transmission of HIV, which is also known as Option B+. Option B+ differs from PMTCT policies in that all HIV-pregnant women will be initiated on HIV treatment irrespective of their CD4 count. The Health Minister, Dr. Jane Cheng, told us about the progress of the program.
We have had a decline in the rates of new infection in children from 28,000 in 2010 to now only 3,400 by 2015.
After a successful launch of the program in various districts, the government signed a number of agreements with implementing partners to ensure continuity of the program. But Shafik says more is needed to be done.
The implementing partner went on and employed 2 people on its behalf, but still they are not sufficient. So I feel like we need one and of a higher cadre who's a technologist. We place orders in NMS, but at times they don't supply. So it means we shall have to omit some of the tests, and yet the patients really need these.
According to Shafik, the hub is meant to provide results to the mothers instantly, but the lack of some equipment makes this impossible. He says they have an option to transfer the samples to the government laboratories via post office, but this is inconveniencing.
The nearest poster is 94 kilometers from here. It is in Impiji. So it gave us a very big challenge, a rider to move on his bike from here to Impiji.
Mildmay Uganda purchased motorcycles which it fuels on a weekly basis to help in transportation of the samples to the labs in Kampala.
And this has helped us to reduce on turnaround time and then the cost of transport.
Shafik says in the past, the long distance would lead to a delay in the results, which made the beneficiaries doubt the process. He also says the samples would go bad, thus altering the desired result. But the improved technology in handling samples has helped them regain the trust.
We put them on what we call, it's called a DBS, that is dry blood sample card. So this card allows the blood to remain viable for quite long.
The health center delivers up to 40 mothers in a month. Abigail Murunji, who supervises all midwives in Gomba, says they are dedicated to reducing the new strains of HIV during birth. She, however, says they are faced with a number of challenges.
The number of health workers, most especially midwives performing option B+, has not been increased.
The health minister says the ministry has dealt with the issue of understaffing.
The issue of understaffing was largely addressed by ourselves and our partners who came in and recruited.
However, the Director of Medical Services at Maldmay, Dr. Yvonne Karamaji, one of the implementing partners at Madu Health Center 4, differs from the minister's response on the same issue.
We still need more midwives, laboratory technicians, doctors at these health facilities to be able to manage the high level of numbers.
We have already committed ourselves. We are now costing for the intervention because this intervention is for life. It is not going to stop. And so we have to make sure that our costing is very correct and that our sources of funding are concrete and sustainable. We shall be engaging Cabinet in the very near future on this issue as well as Ministry of Finance.
Authorities at the Ministry of Health are now working on involving husbands of women benefiting from EMTCT. According to medics at Madu Health Center 4, many women visit their facility without partners, which leads to complacency. Walter Mwesije,